Welcome to NCLEXMap, where knowledge transforms into confident action. Today's lesson, Legal and Ethical Nursing Practice, the compass that guides every safe, professional decision you make as a nurse. Nurses carry two vital duties, legal responsibility and moral accountability. The legal protects rights. The ethical protects dignity. Both must work together with every assessment, every chart, and every conversation. Let's ground this in core principles. Autonomy honors the patient's right to decide. Beneficence means doing good. Non-maleficence means avoiding harm. Justice ensures fairness, and veracity demands truth. When we talk about consent, autonomy and veracity meet. The nurse's role is to witness and advocate, not to persuade. Consent is valid only when a patient understands, agrees voluntarily, and is competent to decide. Here's the scenario. A 62-year-old man, pre-op for gallbladder surgery, receives sedation. When asked to sign consent, he slurs, "Why am I having surgery again?" His daughter is present but has no legal power of attorney. The provider insists, "He agreed yesterday, just have him sign." At the same time, another nurse whispers that a student posted a selfie in pre-op showing this patient's name on a whiteboard. Suddenly, you face both an informed consent crisis and a HIPAA breach. What do you do first? Step 1. Recognize cues. The patient is sedated and confused. Step 2. Analyze. A confused patient cannot legally consent. Step 3. Prioritize. Protect autonomy and privacy now. The RN must stop the process immediately. You calmly tell the provider, "He is not alert enough to consent right now." You advocate, not oppose. The provider must re-explain the procedure when the patient regains clarity or involve a legal surrogate if needed. Next, handle the privacy issue. Any identifiable patient information shared publicly, even accidentally, is a HIPAA violation. The nurse reports the breach to the charge nurse or privacy officer per policy. Never ignore it. You complete an incident report describing the facts objectively. No blame, no emotion. This isn't about punishment, but quality improvement. Documentation of corrective action builds transparency and learning. Then you privately re-educate the student nurse. You explain why even an innocent photo can expose protected information and risk patient trust. Teaching with respect builds a just culture of accountability. Legally, the correct actions are to stop consent, notify the provider, report the HIPAA breach, complete an incident report, and educate the student. Ethically, they protect the patient's safety, autonomy, and dignity. This single scenario reflects every ethical pillar. Autonomy, honored by stopping the invalid consent. Beneficence and non-maleficence, acting to protect from harm. Justice, applying equal standards. Veracity, telling the truth. Understand the boundary between negligence and malpractice. Negligence is failure to act reasonably. Malpractice is professional negligence that causes harm. Ignoring confusion during consent could become both. When faced with an ethical dilemma, like life support withdrawal or a patient refusing blood, seek guidance. Use institutional policies, the ANA Code of Ethics, and ethics committees to balance rights and values. Every nurse must also protect confidentiality in the digital era. Avoid sharing patient details on social media, secure records, and verify identity before communication. Every click counts legally. Incident reports, consent verification, HIPAA compliance, and mandatory reporting are not paperwork. They are ethical armor that guards your patients and your license. Do them well. Do them consistently. Remember, the nurse's integrity is measured by actions taken when no one is watching. When uncertainty arises, pause, assess, advocate, and document. Ethics begins where comfort ends. In summary, protect rights through informed consent, prevent harm through vigilance, and preserve trust through confidentiality. Legal and ethical nursing is not optional. It defines professional excellence. Thank you for joining this informative channel where judgment meets action. Like, share, and subscribe for more high-level clinical reasoning power lessons. Because integrity isn't a chapter, it's the entire story of nursing.